Okay. Hi, Mrs. Luter. My name is student physical therapist Eric Luter, and I hear that you're coming in today for some hip pain.
Yeah, I've got some pain and some popping on the right side.
On the right side. Okay. Well, first things first, I'm going to take a bit of a history from you. Um, so your name is Kelly Luter. What about your date of birth?
It's 4/23/1996.
2396. Okay, and that puts you at 25 years old, correct?
Mm-hmm.
Okay. And then what do you do for a living?
I'm a medical student.
Medical student. Okay, perfect. Okay. And then from therapy, what would you say your goals are?
My goal for therapy would be to decrease the pain I feel in my hip, and also prevent it from getting any worse.
Sure. Okay, so decrease pain and not let it get worse. Okay, and did you have a doctor's referral? Did you come in on your own?
I just came in on my own.
Came in on your own, okay. So that means that you most likely haven't been previously examined for this issue?
No, I haven't.
Okay. Okay, let's get into the injury a little bit. So where, or do you mind pointing out where your symptoms are occurring?
Yeah, so it's like this part of my hip right here.
Just on that front side?
Uh-huh.
Okay, sounds good. Thank you. Okay, and then could you describe the symptoms for me?
It's kind of like a brief, sharp pain that just kind of happens when I move my leg outwards.
Gotcha. And when that pain occurs, on a scale of like 0 to 10, how bad would you say it is?
I'd say it's like a 4.
A 4? Okay. Okay, and is there anything, you said that like twisting it out makes it worse.
Mm-hmm.
Is there anything else that makes it worse?
No, it's mostly just kind of moving in that motion.
Moving in that
outward motion.
Okay. Okay, and when you do have that pain, does it linger? Does it stay around, or is it just in that brief moment?
It's pretty much just in that brief moment.
Okay. So I know that it doesn't stick around the pain, but is there anything that you've noticed that makes it better? Is there like a certain position where it won't pop as much in, maybe sitting versus standing, something like that?
Not as much in sitting.
Mm-hmm.
But I'm not really moving my leg in that motion when I'm sitting.
Right.
So once it's kind of in that like outward motion, there's nothing that makes it feel better.
Gotcha. Okay. And then have you noticed if it hurts more in the morning or the evening?
It's usually more painful during the evening, like after I've been kind of on my feet all day.
Evening after you've been on your feet, okay. And then a little bit more specific positions that I want to see if you can do. Are you able to cross your legs without the pain coming on?
There's a little bit of pain, like right now when I'm doing this.
A little bit?
But if I kind of let my leg down, it's not as bad.
Okay. How about stairs? Have you noticed that it comes on the stairs?
Not so much with stairs. If I did like multiple flights of stairs, maybe.
Mm-hmm.
But 1 or 2 is not bad.
Okay, gotcha. And then like if you're pivoting while you're just standing or while you're walking, does it have to be that leg sort of turning out for the pain to come on, or?
Yeah.
Okay.
It does.
Gotcha. Okay. Now we're gonna take a quick shit. I just want to get to know a little bit more about your work and home environment. So, at your work, I'm assuming you have to stand and walk around quite a bit. Is there any like obstacles or any, I don't know, is there anything that you're not able to do anymore physically because of this pain?
No, I'm able to do the things that I need to do at work.
Okay, and what does that entail? Is that like quite a bit of standing, quite a bit of walking?
It kind of depends on the day. If we're in clinic, it's quite a bit of walking and standing. If we're in surgery, it's standing for multiple hours.
Okay, sounds good. Standing for multiple hours, quite a bit. Okay, and then in your home, you said earlier that like if you did multiple flights of stairs, that it might exacerbate pain. Do you have multiple flights of stairs at home?
No, thankfully I don't have an issue with that.
Okay, and then any other obstacles at home that you might have that the pain in your hip would prevent you from being able to do?
No, I'm able to get around just fine.
Okay, good. Okay, and then for your home life, do you have a good support system, like a family or anything like that that can support you?
Yes, I have a wonderful husband and a great family that lives locally.
Okay, perfect. Okay, and then really quick, going back to your chief complaint here, when did you first notice this occurring?
I first noticed like the popping sensation about a month ago.
Okay. And then what about the pain?
I would say that the pain kind of came on a couple weeks after that.
Okay, so it's progressed from popping to pain.
Yeah.
Or it's from popping to popping and pain?
Yeah, sorry. That's,
Gotcha.
Yeah, now I'm having both of them.
Okay. And thinking back to about a month ago, is there anything specific that you remember doing that might have caused this? Did you step in a little bit of an awkward way or take a fall or anything like that?
No, like specific event that I can recall.
Okay. All right, so now I want to go on to just sort of your general health. And what would you say your general health is like? Is it pretty good? Okay?
I would say it's pretty good. I try to work out like 3 or 4 times a week.
Okay.
And no health conditions other than hypothyroidism.
Hypothyroidism. Okay. Okay, and then I'm going to take you through a series of symptoms, and these are just yes or no questions.
Okay.
Have you ever had any malaise?
No.
Chills, sweats, or fever?
Mm-mm.
Recent unexplained weight loss or weight gain?
Nope.
How about fatigue?
Yes.
Okay. Any sort of like numbness or tingling?
No.
Okay. Okay, any general weakness?
Mm-mm.
Would like a cough or sneeze exacerbate your symptoms?
No.
Okay. And then any nausea?
No.
Okay. Well, let's get into a little bit of medical history then. Have you ever had any surgeries?
No, I have not.
Okay. Do you have any allergies?
Nope.
Any, other than the hypothyroidism, do you have any other health conditions?
No, that's it.
Okay. And then what medications are you taking?
I take levothyroxine for the hypothyroidism.
Okay. And then we have to ask this to all of our patients. But do you ever, or have you ever experienced any abuse in the household?
No.
Yeah. And then, final question: do you have any relevant family history?
My mom has osteoarthritis.
Mom has osteoarthritis. Okay. And then finally, do you have any other questions or concerns for me?
I don't think so. I think you covered it all.
Okay. Sounds good. Well, I got a lot of information from that, and what I want to do next is just get some hands-on tests going and see if we can really dive into this and figure out what's going on.
All right, that sounds good.
Okay.